Yeah, I'm so extra. Express myself, I'm next up. Yeah, what more do you say? Coming up. Yeah. Come on. Come up now. Come on. Stop me. Come on. You coming up.
Hey, hey. Look
Hey.
at you. You look great.
Thank you. Thank you. I don't look like how I feel. Like I am running on E, but I'm good though. I'm excited about tonight and talking more on what we are discussing. Like I'm excited. I want to hear more. I have more questions. I want more information. So I'm ready. So how you doing? How's your day
I
been?
know. My day has been super busy. I'm definitely for the extra couple of minutes because I sat down at 7 and then looked at my shirt. I said today was a nanny day on my shirt. I was like, oh, I didn't change the shirt. Oh my God. I've
Oh
just
my.
been slumming it with babies all day. So I get myself a little bit together. But yeah, I'm excited about today. You know, we're obviously talking about and obviously we are bringing on one of my, I get to say new because we will soon be coming up on a year since yeah, it was kind of just random and out of the something on Facebook that was advertising for Black women in doula training.
Okay.
And I answered the call and was just like, and it's been, yeah, it's been a catapult and just a snowball ever since. So
And
how are
here
you?
you are.
I was like the lady, you know, the ladies are jumping in. So I was like, you know, just we can bring Erica right on in and you know, just jump in. Cool.
Right. Well, hello, everybody. Hello, Lady Sparina Williams, and hello, Jackie. All right. Hi there, Erica.
Good evening, ladies. How are you?
Doing fantastic. Excited about having you on the show this evening. How was your day?
It was a busy one, but I'm here. How
Okay,
about yours?
good. Same. I think everybody, our days are always busy. So we do what we have to do and we handle it and we handle it well. So, yeah.
Absolutely.
So first, I would like number one, I want to tell you thank you for agreeing to be on the show with us. And since I don't know you personally, I just want you to kind of give us a little bit about yourself and how you got into being a doula, and then we'll get into all the specific questions because yeah, I want to know. I need to know. I wish I had a doula. Like I have 4 kids. I would have if I had known anything about a doula then, I would have had one. So, but anyway, let's go ahead. You tell us
Look, you're
about
not the
you.
only one. I told you I was going to be a surrogate just so I could have a doula.
Oh my god. That's a bit extreme, Morgan. I don't think I want to go that far. Yeah, nah, I'm good. I'm good on that. You can have that. Take that and run with it, but nah, I'm good.
Well, thank you, ladies, for having me. It's definitely an honor to be on the show and to, you know, spread more awareness about doulas. Ironically, I didn't have a doula myself for any of my 3 births. I wasn't very knowledgeable about it, and I too wish I had one when I had my last 3. Um, a little bit about me: I was born in Texas, raised in Pennsylvania. My mom was a nurse. I ended up becoming a nurse, and it was during nursing school where I kind of learned more about the role of a doula. The mother baby unit or maternity unit of my classes really were like my favorite. And then learning more about the role of a doula, which is a non medical support person. Um, I was like, yeah, I want to do that. But it took me a while. I graduated nursing school, worked as a nurse, specializing in pediatric home health care. So still with the babies, because I love the babies. Um, And once COVID hit, I kind of was at home with my kids because they were virtually learning and whatnot. So someone had to be there with the three of them. And I was bored. I'm always on the go. So I was like, you know what? Let me pursue my passion, and look back into becoming a doula. So that's what I did. I took the time and did some trainings, a lot of trainings. I'm kind of overloaded on trainings, if you will, to learn the role of becoming a doula, and I've been going ever since. I started an LLC as as my beginning business. What I did notice is that, you know, the community that I was looking to serve, because I did learn more about Black birth disparities, where Black birthing people are 2 to 3 times more likely to suffer negative outcomes in relation to pregnancy, childbirth, and their postpartum period. A lot of the people that I was looking to serve couldn't necessarily afford the services. And then also on the flip side, if they could afford the services, I personally feel like we shouldn't have to pay for extra support because of something that is taking place that is out of our control, if you will.
Mhm.
So through my mentor and through just watching other people, I established a nonprofit, which is Do Care Doula Foundation. And
Wow.
that's been up and running since what, 2021. So we're newer, um, but we're making a lot of progress.
Good. I applaud you for recognizing the disparity and how there needs to be more education, because we are, just hearing the more recent stories of, brown and black birthing women and things that have happened and death that has taken place unnecessarily. We need more education. And now we have all of these COVID babies coming up. So many people, they were not practicing social distancing. So now there's more, and our population is growing. There needs to be more education, especially in our community. So I applaud you for recognizing that and starting the foundation. Hopefully, that will just trigger in other places as well. This platform will go and spread out where more people will see that. So that's very interesting. Can you tell me a little bit about the training? Like, is it formal school or is it just classes? How is the training for that?
So it varies, from organization to organization. You have some trainings where there's a lot of things required, such as reading 12 books, doing a essay. What else? Um, there's some that are very involved, I'll say that. And then there's others where you can go, learn on like a 3 day time span, like 48 hours or so of your time, if not more. And you take a test and you get a lifetime certification. Whereas some of the other ones, like I said, they're very involved, they're very expensive. And ironically, I feel like, just in my experience, the ones that are very expensive, or that I've taken that are very expensive, are not as in depth as the
Mm,
ones that aren't as expensive, or maybe they are run the same expense, but they don't require you to jump through as many hoops.
okay.
They're a little bit better, honestly. That, you know,
Mhm.
not having to pay an annual certification fee, not having to recertify, but having your lifetime certification. Of course, as doulas, we're always gonna keep educating ourselves because things are changing. Even with having, you know, kids, being pregnant, like, things are always changing. Like, you'll have a baby one year, have a baby a couple years later, and they're like, do this, but don't do that. And you're like, well, they said do this last time. So it's, things are ever evolving. So you'll want to personally keep up on what you want to up on, but not necessarily be forced to do so or pay to recertify, if that
Right,
makes sense.
right, right. So are there conferences that are held that you can attend where doulas from, and I don't know how large the population of doulas are across the United States, because it's so, I mean, I don't think it's fairly new, or has it been around and just not recognized? Is that how it's
It's,
been?
yep, it's been around for a long time and
Okay.
just not necessarily recognized. With, even with the Black birth disparities piece, like, a lot of people weren't aware of that even being a thing. To be honest, when I started as a doula, I wasn't aware of the Black birth disparities portion. I mean, I know when I had my 3 kids, each time I went through some type of disparity during my pregnancy, during my birth, and even when when my son was a baby. But I still wasn't aware that it had a name, you know what I mean? Or that like it was something that's recognizable. So once I did do the training and, started networking with people who are in birth work, I did learn, that it was Black birth disparities is a thing, and it's something that we need to combat. But there are a lot of doulas, and there's more popping up now,
Right.
nonstop. Yeah.
Right. Wow. Well, I won't like ask all the questions. I'm gonna let Morgan because I could just take it and run with it. Like, okay, well, what about this and what about this?
Well, look, you already know, like, this is my realm, so I'm letting from a different perspective, because Erica, I don't know if you know, Bill is on the surgical tech side. So
Okay.
we were laughing because I said, you never know, I might end up, being a doula for someone up by you. I said, God forbid we end up, in a C-section kind of situation. So that at least I know I got the right person on the inside.
Facts, because I'm gonna make sure
On the,
that things go smoothly. Yeah, I don't play those type
exactly.
games. Oh no.
So I was like, you actually hit a lot of key points and questions that I was going to ask. But I guess what is your ultimate goal for Do Care Doula Foundation? Where would nonprofit go?
So there's 2 things that I am, there's a lot of things I'm passionate about, but the 2 things that I'm very passionate about is making sure that we have enough Black doulas to support Black birthing people. Also, in addition, and kind of hand in hand with that, I know that like the state of Delaware will be, Medicaid will be reimbursing for doulas more than likely this year in the fall. So with that, I'm trying to make sure that our doulas have all the credentials that they need. So once that Medicaid situation rolls out, they're ready to hit the door. So that's a part, training Black doulas to support the community, and then making sure that we keep funding to be able to support Black birthing people, and provide doula support to them, because not everybody has Medicaid. So the ones who do not have Medicaid and won't be able to take advantage of it, make sure that there is funding. Because again, like I said, I don't care if you're the richest of the rich. Like these birth disparities, I don't think anybody should have to pay to have support and have someone help watch over them during this crucial time in their life.
Mm-hmm.
So is the care that you provide, is it expensive? Now I don't need, you don't have to tell me like the cost, but is it an expensive cost, or is it something that's manageable? Because I know you guys are not, I almost want to equate you to like a midwife, but with the whole support, but you're not actually delivering the babies. You're giving the support to the mom and to the birthing person and to their partner and the families. But is it something that um, is expensive to obtain? Because I know if you're just now getting coverage for Medicaid, I'm sure regular insurance companies are kind of skeptical about covering your services.
Yes. So I have no problem discussing numbers. Like when I was doing my services through my LLC, my fee was $1,500.
Okay.
And that's whenever I pick, we meet. You could be newly pregnant, you can be 30 something weeks pregnant, but whenever we establish, usually I will provide at least two prenatal visits. So meet with you while you're pregnant twice, minimally. Like I said, it usually ends up being more than that. Sometimes we go to doctor's appointments. It just depends on what people um, require or need from us. Then complete support of their childbirth and labor experience, and then follow up postpartum visits. A minimum of 2
Okay.
is what's included for that $1,500. For our doulas, we do reimburse. It just depends on the level. Like we certify when doulas are working towards their certification, they get a little bit less while they're still learning, but they're still getting paid to learn to do their doula support. And then once they've graduated beyond their 3 certifying births, then we pay them at a regular rate. I believe it's right now with grant funding is like $800 per birth that they're paid. And I believe for Medicaid, I'm not sure, maybe about 1,000 or so. That will be the reimbursement rate when everything comes through.
Okay. All right. So everyone's saying hello. Hey, somebody's on Facebook. Your name isn't showing up, but hello. Hi, Corey. And then hey, RJ, how are you? So how many doulas are in your foundation? How many do you have with you now?
Right now we have over 30. So
Wow, really?
yes, and yes.
Whoa.
In 2021, which was our first training, we trained and certified 6 doulas. And then in 2022, we trained and certified 8 doulas. And then 2023, we trained and certified, I believe it was 20 or so. So yeah,
Oh my.
we're that's why I said sometimes I don't realize like it all started from a little thought process and a little nudge from, a couple people, and it's like, wow, 30 people is a lot.
That's a lot in a year's time. That's a
Mhm.
blessing. I mean, that's
It is.
really a blessing. Okay, we need to spill that on over into Jersey, and then we need to hit, we need to just hit the DMV, just that whole area. Wow, that
Yeah.
is something.
Well,
Oh my,
that's what I actually I about, what the foundation provides, because is the foundation that the community doula program is underneath. As Erica was saying, she's like, she wants to make sure that, we have enough. First, the reality is this is vibe work. You know what I mean? So if your vibe is not, we need as many people as possible. So being able to have a website where people can be able to take a look at, the different doulas that we have. Everybody provides different. It's really a realm where everybody can kind of get in where they fit in as far as birth, and then be able to still, be able to support, and everybody for whatever very into, we, can be able to service that. So, I'm just, how it works out, because you really do get a wide variety. And, some, if we're not, working with, specifically with, central, that's what CDCDP is, then we do personally, have a couple of doulas that, live in Maryland. So although, we are aware, that doesn't mean that if you're living in Maryland, they won't do have, some reach in our own personal things. So
okay, okay. All right. Oh, so let's see. RJ says, are that many people having babies we post COVID fertile? Yes. I
Yes.
hey, not April, but others. Let me preface that. Not me, because I'm done, but everybody else, yeah, they having the babies. And I told my mother, she owns a daycare center in Georgia. I said, listen, you need to come and open up a daycare center here in New Jersey, because you will fill up just like that. And there's babies, people having babies everywhere. So there is definitely a great need. All right. So my mom says, is this something that will help with postpartum depression? Oh, that's a good one.
That is something that we work to do. That's the reason for those postpartum visits. Also, following along with our people, even with the prenatal visits, it allows us to get to know those that we're supporting. So, once they have their baby, if something seems off, they don't seem like their normal selves, like we can identify that because we've established that connection and relation, as
Right.
opposed to them, being in the hospital, zipping in and out, and nobody catches that. So
Right.
being there for the prenatal visits, being there for their birth, and then checking in with them postpartum. Sometimes it can be a little bit difficult to check in postpartum because, people want to sleep. They have babies, they want to sleep when the baby sleeps. But
Right.
that's something that we really try hard to do. Make
How
sure that they're good and refer them out if they're not.
right. How is the relationship between the nursing staff in the labor and delivery department with you, because of course the nurses, and I get it in surgery too, because they think, we're surgical technologists, we're beneath them, and that is not the case, because if I walk out this room right now, you will not be able to do what I do. So how is the relationship with the doulas when you come, it's with the nursing staff?
It varies. There's egos involved, I feel as
Mhm.
though. And like you said, some people let their title, you didn't say this, but so much so, some people let their title go to their head or think, they may have had a bad experience with someone who is a doula, or they may not
Mhm.
understand like what our role is there. So it's funny because I'm a nurse, but I'm also a doula. When I am a doula, I'm not operating in the space of a nurse, but
Right.
um like I see it. I see the standoffishness. I see even with providers, like they'll try to challenge. I know I had a person who was giving birth, and they decided they wanted to give her a C-section. Wasn't necessarily necessary, but yeah. And they're like, well, your doula didn't tell you about the hazards of anesthesia. I'm sorry, that's your job. I'm here to provide support. I am non-medical. Yes, I can educate them, but
Right.
when it's time for a C-section, I'm not getting paid the big bucks like you are. Like that's
Right.
your job to go over all of that information, and it's my job to make sure that they understand the information. If they have any questions or need to advocate, like we can go through that. But it's funny, the little I
The
don't
little
know.
jabs that they take, yeah,
Yeah,
the
and it's
slick,
so it's
the
so
petty stuff.
unnecessary.
Oh yeah, yeah,
Yeah,
it
because
is.
I'm a firm believer, like, I can't take care of somebody all holistically, like all that they have going on when they're in labor, having a baby. Like it's a team effort, it's a joint effort. So I'm not there to step on anybody's toes. I have my lane, they have their lane. And if we can all work together, drive on the highway in our lanes, like it'll be all right.
Right.
But some people feel threatened, unfortunately.
So, is it difficult for you to build up the trust with your those that you're providing care for? Because obviously they call you because they want to utilize your services, but are they kind of, do you have to build that to let them know, look, I'm for you, I'm yours, on your side to help you, or do you find that they are just willing to say, okay, yes, I want you to support, I trust you. What do you think about this?
Um, it it depends. For the most part, I'd say like 90% of the time it's good, like building the relationship with them, not a struggle. Some people are a little like nervous or standoffish. I think there's a lot of different movies and Lifetime shows crazy stuff about people snatching babies and things. So I've actually had some people be like, well, why are you offering this service for free? What's in it for you? And, like, is this a legit thing or a scam? And I'm like, I promise you, I'm not getting up out of my bed at 3 o'clock in the morning to scam you out of anything.
I know that's right. I
So
would prefer to be asleep. Thank you.
yes, I would rather be asleep right now. So yeah, no, it's not a
Right.
scam. But for the most part, everybody's receptive. One thing, sometimes there's miscommunication, misunderstanding between partners, like the uh, husband or spouse, or even moms, like grandmoms. They're like, well, I've had one say with me sitting right there, I didn't have no doula when I was having my baby. What's she gonna do? And I'm like,
Oh, wow.
well, what I'm here to do, but people can't help themselves in this
Yeah.
entertainment. So
Oh my
I'll happily answer what I'm here to do.
So glad you're able to let that stuff roll. It's like working in surgery with surgeons who are just very irate, and it's like, yeah, okay, now next, what are we gonna do to help this patient? Okay, I need you to calm down. Like I'm not trying to hear that, and I will tell them that like straight out my mouth. And my students are like, "What? Oh yeah, I check a surgeon in a minute." No, we're
Yes,
not having
they're
that
people.
attitude today. No, calm down, sir.
Yeah.
Calm down, ma'am. We're not
Hmm.
doing that. Wow. So my mom says your services are needed. Nurses in the facility are in the facility. What happens after mom gets home and needs support? That is so true. And the nurses have been, in my opinion, they're like institutionalized. It's like, I'm here for this. Once you deliver that baby and your doctor clears you to discharge you, I'm done. And on to the next. Okay. But what about afterwards? What about when they move on? What about making sure they get the care they need while they're there? Don't just leave them in the room by themselves and they need some help. Like, oh my goodness.
Yeah. When
Oh
they get
Yeah,
home, we're
absolutely.
available. We're still available and on call. I've had people reach out to me about 6-month immunizations, and the baby has diarrhea after my first doula client was back in what, 2021, 2020, yeah, 2020. I've been to the baby's birthday parties. Like, I still talk to them. We're like family. It's not like, okay, I'm supporting you and then we just fall off. No, we're family. I'm not pushy or on anybody, not like that. But if you need me, like, I'm here. You can hit me up, inbox
Right,
me, message me, or whatever. The support doesn't stop.
right, right. So you become a part of the family
Yep.
long term.
Hmm.
That's pretty
Yes.
cool. That is so cool. Morgan, you just gonna sit there? Oh, so we're gonna do this again? You know what she does to me? Like, she will just be like a little church mouse. I'm just gonna sit here and be quiet. And I'm like, hello? Okay, fine. You be that way. You be that way. That's fine.
Listen, I listen as much as yeah, likely left. We can pull it back the opposite. This is my new cup of tea. This is something that I absolutely love, and so Erica all day about this, you, you know.
So,
But so okay, besides um besides doula training, do you provide as far as the foundation is concerned, whether we're birth workers? I
So a big
like
piece
the pool.
too is that we provide community resources and education. Last year, we hosted, what did we host? The first Black Birth Expo in Delaware, where we had over 30 vendors come out who were, say, like Bay Health Hospital, people that do event planning, people that other doulas. Actually, we had a whole variety of anybody who can correlate to birth and supporting Black birthing people. They came out, and then we provided giveaways such as like strollers, high chairs, diaper bags, breastfeeding supplies. We're doing that again this year, which that event will be April 16th, and it'll be held at the Great Hall in Dover. Again, I think we have right now at least 20, if not close to 30 vendors signed up to come out
wow.
and be a part of that expo. We have a lot of giveaways this year, more than we had last year. I'm looking at the stuff like, okay, it's starting to take over my space, but um, excited to give away those things. We have a lot of community partners that we have gained through the support, where they provide referrals to us, we provide referrals to them. There's so many services that are available that you wouldn't know of or you wouldn't even think of out there. So we have a lot of community partners as well that participate in the events. Last year, we also held a SIDS event, teaching about safe sleep. We had a class taught by a pediatrician from Christiana Hospital.
Mhm.
And once the people completed the class, they got to leave with a free pack and play. So they had a safe sleep space for their baby.
Wow.
We also had a community baby shower where people came out and were able to grab items that they need: onesies, bibs, bottles, diapers. We had so many diapers, it was ridiculous. Baby wipes, and they got a free brunch. We had Santa Claus there to take pictures with the kids. I'm trying to think if there's anything that we missed. And then before that, in August, we had a community day where it was also like an event where we gave out breastfeeding supplies, had entertainment for the kids, had free food. So we try to do a lot of community outreach to spread awareness of the fact that we're here, to spread awareness of different issues that affect the community. Like I said, SIDS. Also, having a baby is expensive, so I try to
Mhm.
make sure we have great giveaways for people, and then things to support like breastfeeding and whatnot.
Right. Which is
Um,
why I'm not having any more. I don't need to go backwards. to the sleepless nights and the diapers. I love babies, but yeah, no, no. Well, it sounds like you
Exactly.
guys have really made an impact in the community. Definitely needed and definitely bringing more awareness. And I'm hoping that this will do the same thing because we need that extra support. You know, I mean I don't have the time to put anything else on my plate, but I'm almost interested. Like, ooh, maybe I could do that because I love that. I love the whole delivery and birthing process.
Mhm.
I do. I love it, but yeah, no. Just I don't think I could put anything else on this overflowing plate of mine. So I'm gonna let y'all have that and do it.
Well, remember that if nothing else, you can come in and partner with us, coming things to be able, if nothing else, to educate us non-medical birth workers on especially when it comes to C-section. This way, we can still better be able to educate our, our clients on what happens if, what I mean? Support women who have emergency C-sections as well as scheduled. So it however your birth is, whatever, and that includes adoption, that includes surrogacy, that includes, even, I mean, there are dual. So it really just depends. Like birth work, as I was saying, fast and wide. That depending on really what your interest is, what you feel like your call time you can be able to put in. I don't feel like there's too much or too little at the end of the day.
Well, I'm all
Oh,
for
I had
that.
another question actually. You said you
Yeah,
what?
I can come in and do the teaching and training from the medical standpoint with the C sections and what it's all involved from that on the other side of the drape. I can tell you about that and how that's going to be. So yeah, I would love to do that. Now that you mention it,
Absolutely. We'll set something up because I know that like a lot of our doulas, that's something that we are want that extra information, because once again, it's not that we're trying to step on Toast's lane, but this way, just from standing back and knowing what should be happening or what the general process is, then if something doesn't right, you know what I mean, we can be able
right?
to that red flag. That's why we're there. We're also a person who can better explain what's going on. Remember, when someone goes action, they normally say everyone's gonna bum rush you like a pit crew, and it's gonna be like one time and this, that, and the third. So they're telling you that you don't. That's all they tell you. If I could in the beginning let them know what this pit crew is doing, increase the blood
Yeah,
pressure at the time, which a lot of us get because we're just only are we about to have a baby, but you about to cut me open, you about to take every organ in my body table, pull this
right.
baby out of me, and then stuff it back in, and then staple me back. Like to not rise.
Yeah,
You can't expect me to not feel some type of way. So if we can, and still even in that setting, make a positive birth experience out of it, then why?
yeah,
I'm all for it. I'm gonna always find a
yeah.
spot for you.
Yeah, definitely having that information because I can let them know, step by step, this is what's going to happen. This is how it's going to be, and things are going to go quickly. And so you have to be prepared for that. But then, too, there's also the side effects that they would experience from the medication that they're going to get because they always, without fail, throw up all the time while we're trying to deliver the baby. They're over there throwing up. So just having that knowledge of, okay, if this goes south and I need to go in, I need to know what to expect because like you said, heart rate increases, blood pressure goes up. Then if we're struggling, then they're going to have to mask them down really quick. But with them doing that, that crosses the placental barrier so fast. Like we are on a really time crunch to get that baby out of there and then let her wake up while we're closing her up. So, there's a lot of education that needs to come because I've had ladies come into the OR just terrified because it was emergent and they had no clue. And so they didn't have the support. And then everyone's moving so quickly, no one's giving them
Right.
the information that they need to kind of keep them calm. So, yeah, I will do that. Set me up, put me on your
Absolutely.
calendar. I will
Absolutely. If
do that.
nothing else, then we can be able to give you on our end some of the things, surgical standpoint, when you're talking to your colleagues, maybe they can understand because, I've had since where they're like, okay, well, it wasn't a scheduled C-section, but it was to do, it wasn't emergent, like, baby needs to be taken out right now, but it was something that we need to consider and maybe really like have a conversation about. And they're like, okay, for like 30 something hours already, can I at least freshen up, breast like a human again?
Right.
Why can't we give her that dignity, risk or whatever? You know what I mean? To be able to do that. If it is, then can you give us a bedpan or a kidney pan or something so that we can bring a sink to her, so to kind of feel like herself,
Yeah.
because everything is changing and rapidly, mental state as well as the physical state of that birthing person is, especially when we're talking about other things like blood pressure, like, you know what I mean, different side, all of these other things, like there's a lot of factors at play, into our health and how we're, so I'm excited. So yeah, we'll put that together. We'll put that
Sign me
on the
up,
list,
Erica.
Erica.
I'm coming. Sign me up. I'm excited. I love teaching is my thing. So I love if I can educate people on whatever knowledge I have. Yeah. So, but enough about me. Let's get back to this doula business here. Let's just
Yeah.
finish
So
talking.
listen, Erica, tell us about the coming up. What is the purpose of the sneaker ball? What we're doing for the sneaker ball, and you can get people hyped about that.
Sure. So last year we held our first adult prom fundraiser. And this year we're having a masquerade sneaker ball. That's March 10th, held in Dover at the Correctional Officers Association Hall. It's March 10th from 7 p.m. to 10 or 11 p.m. We will be serving dinner. We will have a silent auction, a phenomenal DJ who gets the crowd moving. Um,
Okay.
we have from the silent auction, we have donations from the Philadelphia Eagles, a signed, autographed picture. We have something signed from a baseball signed from the Philadelphia Phillies. We have massages. We have hairstyles donated. I'm trying to think. We have a lot of different things donated. So we are definitely looking for people to come out and support, because we do get grant funding from corporations, but having that extra funding and support is like very beneficial to us. Again, sometimes people may not fit the criteria but may need support. Sometimes people may need, say, postpartum support but no birth support because they're having a C-section. Different things pop up that we may not necessarily have be able to support via our current grant stipulations. So being able to have that extra funding as well as spread awareness, because that's what we do. We do talk about the Black birth disparities and everything during our events. So we would definitely love people to come out and support this event. It's going to be amazing. It's going to be fun. Like I said, the DJ keeps the crowd moving. The food is always on point. We do have a cash bar. Trying to think what else will take place that evening. I think that's about it. Have some delicious desserts. So it's guaranteed to be a good time, but we definitely want people to come out and support. You can go to our site, which is dedoulas.com. Again, it's dedoulas.com, and you can purchase your tickets there.
Sounds like I need to go ahead and book my hotel. I'm coming.
Yes, come through.
Yes.
Oh,
Come through.
okay, I'm down. That's like in a couple of weeks too. I'm
Yes,
down
it's
to
Yes.
be
coming up.
there. So Jackie asked,
Absolutely.
she's in Georgia. Where can she go to look into learning about becoming a doula?
So there's a lot of doulas in Georgia for sure. and there's different networks and whatnot. I would say use Facebook if you are on Facebook, which you are. It looks like use Facebook to look up doulas in your state. Also, training wise, there's a lot of different trainings available. I started out with what's called Dona training, which, like I said, is more involved and a little bit more financially taxing and some more requirements. But the training that I firmly stand on and that we use uniform now for our doulas is called Common Sense Childbirth Institute. They're located in Florida, but they fly up to us to come do the training.
Mm.
But you can also do the training virtually. So I highly recommend Common Sense Childbirth
I do
Institute to
too.
look into becoming a doula. Yeah. It's
Yeah, I was
really good.
like, I've been one so far, and I'm on like maybe training number. That was like my fourth training. Favorite one so far, because you get different things from everyone. I've had a training that was more business focused, which is perfect if you're trying to set with her LLC. So, not only can you support, but this is an opportunity for an entrepreneur. So having someone to be able to give you that and, even mentor point is also, great. So, some people are more technique driven. Some people are more lactation driven, culturally, certain cultural practices. Erica, that was a really good thing to suggest as far as, look, because then you'll really get a feel for who's taking what, who offers what, and then trade a little bit more, and take the trainings that you feel like would best fit the area. As far as locally, Erica, besides obviously working underneath your umbrella, who does Do Care Foundation and CDCDP have like partnerships with, like other organizations that we partner with?
Sure. So Children and Families First of Delaware is one of our community partners. DAPI, which is Delaware Adolescent Program, which is a program for teen moms to continue their education. Even when they have a baby. I love that program. We're partnered with them. We have a lot of partnerships. We work and communicate with different entities such as like Ultrasound Express, which is located in Milford, Delaware. They provide early access care to people because right now we're in a shortage of OBGYNs, and that puts us at a shortage of appointments for people when they're pregnant. They might not see people till they're in their second trimester.
Oh,
So
wow.
I've been, referring people to Ultrasound Express because they can go get care and be seen by a midwife and get an ultrasound and get blood work and something to hold them over until they are able to actually get in with their provider. But yeah, we have a lot of different community partnerships.
Have you been approached or either considered like expanding into another state since you are doing very well where you are in Delaware? Have you considered coming to a neighboring state and opening up a sister location there to start?
I haven't. Only reason being, so in New Jersey, they have Medicaid approval already, and they have doula. They have what we are doing
Okay.
already. Even within like this state, there's 3 different counties: Newcastle County, Kent County, which is where our primary focus is, as well as Sussex County. There's 2 other community doula groups. One who handles a lot in Newcastle County, which is Black Mothers in Power. I don't know if you're familiar, but they have a community doula program. And then there's also Parent Information Center of Delaware. So they have a community doula program as well. We are also community partners and work together. But yeah, I kind of stick with the focus, especially with our grant funding comes from a corporation in Delaware.
Okay.
So we kind of stick to Delaware. I honestly, I don't know, because from start to finish, from a lot of the different things that get done, like it's me. I'm the one that answers the phone when you call. I am the one that does a majority of the things. There is some, I have some doulas who I work closely with that do help out, but it's a lot. So as far as expanding, I would have to build a heck of a team to be able to expand. Like having this 30
Right.
right now, it's like, whew, it's a lot. I'm
Right.
grateful, but I'm like, okay, I think we have enough right at this moment, and we just need to get everybody situated and settled and into a groove, and then possibly we'll look to expand more, but still keep it within the state because I don't think I can manage outside.
You already doing so many awesome things.
Thank
So
you.
what kind of characteristics or qualities would a very in-depth or good doula have? Because I know for me, for my students, when we are interviewing them, there's certain characteristics they need to have to be able to work in surgery. So I don't accept just anybody in my program. So what do you look for? What's something that someone should have in order to see that they would be successful as being a doula?
They need to have a certain passion behind them, which you can't always gauge that. What I do find is that some people come in with a passion and it's not necessarily what they think it is, so they may not stay with it or may not do much with it. But having a passion, having a dedication, um, and I say there's not one particular thing because everybody supports different. Everybody needs to be supported different. So whereas one doula might work for one person, they might not work for the other person. So it's variable, the different personalities or strengths or whatnot. Like for me personally, I'm the type of person, I'm not extremely talkative. I'm very quiet. I usually push somebody else to the front, like, you go ahead and make this announcement, because I'm not a person that likes to be out there in the forefront. But and sometimes that works for people. Like they want somebody who's not going to be like nonstop talkative or too much going on. So it varies. There's no particular thing that makes them be a good doula, except for, they do need to have the passion, the will, and the drive. And then they
Right.
also do need to understand that, again, I'll say that 3 a.m. thing.
Yeah.
You're going to get called at 3 o'clock in the morning and woke up out your sleep to go support someone and be in the hospital or be in the home or be at the birth center supporting them. So being able to know, like, you have childcare on hand for those crazy hours if you're a single mom. So it's just, there's some different things that I do ask people, and I do kind of try to stress to people just because what I've learned along the way of necessities.
So for those that got into it and then walked away, what were some of the reasons why? Did they tell you why they walked away? I'm sure they had different expectations, but what were they? Why did they walk?
Some people just take the training and dip off. I don't know. I can't explain it. You know what I mean?
Yeah,
Um, and then there's other people that is too much. Again, that's why I've started to definitely speak on the piece of needing childcare, supportive childcare. If you're married and you becoming a doula, you definitely need to talk with your spouse about it. I'm not saying ask permission, but you need to have a conversation, because you might be at a birth for 36 hours. That
yeah.
means somebody's got to, take care of the kids, take care of dinner. So all of those things go into play.
Right. Sounds like me getting called in the middle of the night for surgery, two,
Hmm.
3 in the morning to take someone's appendix out. Like, really? And then when you get there, you just can't do that one and then go home. It's like
Yep.
everybody else and their mama comes in the ER and needs
Yep.
surgery. Wait a minute. So what was supposed to be maybe 3 hours ends up being 16 hours. And then I'm now into my shift of doing surgery for the next day. So I'm doing like 18 plus hours nonstop. So yeah,
Hmm.
that's a lot. I can relate to that. Yeah, I've been up many a times in my sleep, like, no, really? So yeah, you have to understand that.
I
Yeah.
like
Well,
to also personally say that um inside yourself, you don't realize how much birth work has impact on you. And sometimes it takes actually being something happening that either stirs something up in you or triggers you or brings being self-aware, really just being able to stay inside self and really check in with. I personally think, you know, having a therapist or at least someone that you could be able to talk to about some things, especially um and our age range, our generation, we're doing a lot of looking inward, and trying to definitely deal with some childhood. A lot of people don't realize that some of that does stem in the birth work. It stems from your mother dealt with, and you have no idea why you're feeling the way that you're feeling or acting. So, in that space, as far as a birth worker is concerned, understand that things can come in and they can infiltrate, and you need to be able to figure out how to deal with that. You don't have a poker face when stuff gets real and, you know, people are screaming or that they need to. You need to be able to save face. If you can't and you're the one who's like, oh, the building's on fire too, then no, this is not the job for you. Fill in the feels, and now you over here igniting that will be that calm, that that baseline in in that space. You know what I mean?
Right, right. It sounds a lot of what I tell my students. You have to stay calm in an emergency. You cannot just go spaz out. You cannot forget what you've been taught. You have to stay calm because if you are like that, the surgeon's going to be that way and the patient's going to suffer. So, yeah, definitely. But our patients are asleep. However, yours are the moms and birthing people that you're helping, they are not. So definitely have to be able to handle that. Yeah, interesting. Well, I am so glad that you agreed to come on and be our guest today. That we have gotten 2 good weeks of doula training. Like, if anyone watches these from last Tuesday and today, if that
Yes.
doesn't spark you to want to do some doula training, like, I'm interested. It's very, because I didn't know. Like, I had no clue. Um, but definitely needed. Definitely, I applaud the both of you for going into that field, even though it can be a little bit tedious at times. But yeah, you do it because you love what you do, and I'm sure the people that you help are very appreciative forever for that. So thank you so much, Erica, for coming on.
Yes.
Sure.
Thank you, Erica, for your
Yep.
being obedient to your boredom. I know. I
No
think.
problem. Thank you guys for having me. I
And you did
definitely appreciate
well.
the
You
opportunity.
did well for saying, "Oh, I don't want to be out the front. I don't like to do all of that." But you did well. You gave us some good information. So, see, we brought you out of your shell a little bit, if only for a short time. We got you out of there.
Yes.
So, all right, you
Absolutely.
guys, watch us next week. We have another amazing show. We're going to have a flyer put up, but Dion, Dion's next week.
Yes.
You
Yes.
want to introduce our guest for next week?
I'm so is a very, very good dear friend of mine. She is the leader of UGR 3 Day, which is the Underground Railroad tours, ones that are just days. She also does a 3 day compilation of serving with that, but she does some amazing things. So, and I was like, so why not close out February with really talking about our history roots. She has an amazing personal story and just going through her own back. I can't wait for her to tell you guys like where she runs these tours all the way from like Jersey. And so it's like it's awesome. She's an amazing storyteller, and she on that Underground Railroad. So I'm excited to be able to have Dion
I
for
am
next week.
I am definitely excited too. So you guys join us next week on February the 28th. If you didn't know, we're here every single Tuesday at 7 p.m. Every Tuesday. Did y'all hear me? every single Tuesday, bringing some
Yes.
great content, some awesome guests. We are inspiring people. We are encouraging people. We are uplifting the women. Women, you can do so much. Do so much.
Yes.
You can become a doula. Oh my goodness. Look into that and check it out. You can become a doula.
Yes.
So we're going to inspire, we're going to have all these shows to inspire women to go 1 to 2 steps further in their lives. And some of them may not even know what their passion is, may not even have an idea. But one of our shows is going to spark something. Boom. We had Velvet on a couple weeks ago with her,
Yes.
touch me art. I'm going to call it her touch me art because you can touch it.
Yes.
And now we have 2 weeks of doula. And Jackie, I know you're still on here. Don't think you are off the hook. You have got to come on. Don't worry. We're going to get you on the calendar ASAP. Because I need to see some baked goods. I need some more of those granny's goods. So we're going to talk about it as well. It's exciting. Very exciting.
I'm excited. Listen, the moment I saw, I think it might have been Corey. I saw someone in the realm, and then I saw Granny's Goods pop up on Facebook, and I went and hurried up, and I was like, let me like this page. I can't wait to get some of these cookies. So I'm already, look, I can't wait. So yes, hopefully in here, I will have some cookies, and then I get to not feel like I'm on the out. How great they are.
You need to catch up, Mo. You need to catch up. I'm telling you. I can't wait to order some. I'm trying not to because I want to be good, but oh my goodness. Yeah, you will not be disappointed.
I'm going to order some for us for our first meeting. How about that?
Oh, love it. Love it. Make sure you order them because I don't want to share it. I want my.
Okay, I got you for your. Got you.
I want to be on straight sugar high. Like, yeah, this is great. This is great. Thank you, Granny's Goods.
Yes, thank you, Granny's Goods. Thank you.
Right.
Thank you.
All right, guys. So we are going to be out.
Thanks again, Erica.
Thank you, Erica. We appreciate it so much. So until next week, we're going to say out. That's your picture. That's your picture on our flyer. You like this?
Yeah, exactly.
All right. Have a good evening. We will see you next week.
Have a good one, guys.
Thank you. Take care.
Bye.
Yeah, I'm so extra. Express myself, I'm next up. Yeah, what more do you say? Coming up. Yeah. Come on up now.